conditions, even though leukopenia is well known, it's not common. So once again, cancer of the blood, or the white blood cells particularly, is more commonly in little kids because they were born with a congenital condition, or the bone marrow that is not producing the mother cells, or the mast cells, that's called. Ectasis is collapsing, expanding, dilating, collapsing. Atelectasis is the collapsing of the lungs. When the lungs do not inflate or do not allow air to go in, that the patient dies, that's called ectasis, telectasis. Very, very rare conditions. But once again, you need to know some of the stuff first so you understand what's going on with the body, with the conditions. Ectomy. Ectomy means a surgical removal of something. We're going to remove your appendix. It's called appendectomy. We're going to remove your stomach. It's called gastroectomy. You're going to remove any part of the body. Colectomy. You're going to remove the colon. So it's a surgical removal of, but it's surgically. It's not that you're going to amputate someone. No, it has to be surgical, meaning done by a professional. Otherwise, it will call killing or dismembering, mutilating. That's a different issue. And the medical, remember, this is medical terminology. These are the suffix again. We're almost done. We have like 3 more slides, and we're going to call it the night. Emesis. Emesis is vomiting. So whenever you develop emesis as a suffix, you are vomiting, vomit. So I forgot the name of the condition, of the situation. See, vomiting, we talk about that. Hematoemesis, you are vomiting blood. Pyoemesis, you are vomiting pus. So depends on what you're vomiting, then you call it vomiting. But emesis is vomiting. Emia means blood. Remember, leukemia, emia. Anemia, emia. So the whole thing goes together, so we do not separate it. So it creates like an adjective suffix in this case, because em means blood. Ea means the suffix, a condition, or state of blood, state of not having enough hemoglobin, so on and so forth. We talk about anesthesia already, sensation, anesthesia, remember. We have globin right here, talking about hemoglobin. This is a protein. Protein. Globin is a protein. There are many proteins, but we talk about hemoglobin. Hemo is blood, globin is a protein. The protein that is inside the red blood cells, which is called hemoglobin. Gram, remember we talked about this during EKG, is a recording, is actually the printout of something. So if we did the electrocardiogram and we print out that copy that we give to the doctors who can read, interpret the results, that's called gram. So that is the, oh, what am I doing here? The recording, see, a recording. If you said a mammogram, oops, that's the recording of the muscles, what we find inside the breast. So we can interpret whether you have masses that might be cancer or not, or something else. So that's a mammogram. We are finding some abnormalities inside the tissue. A recording. Graph. Graph is the machine, like mammograph is the machine that produces a mammogram. So instrument, see the machine, the instrument that records something. Electrocardiogram, that's the machine that produces an electrocardiogram. Graphy is the process in which we enter all the information of the patient, we attach all the cables on the patient arm, chest, and legs, and then we enter the information in the machine, and the machine produces something. So all the process of capturing the electrical impulses of the heart in different viewpoints that is going to be represented by these graphics on the paper is called graphy, the processing. So that's basically what it is, process of recording. We're going to be seeing this over and over and over because the patients are ordered to do all these processes, all these exams that we are later on going to interpret the results that has to be recorded in paper or on the screen of these devices that we're going to use. So that's how it works. So it's not that difficult. So we're going to be talking about all these over and over and over. This is simple. I think that, let me see how many more suffixes, because we're going to be seeing this in other chapters. I don't want to spend too much time and going to other things. This is the same thing. Remember that I removed a bunch of slides because this was very difficult. Okay, let's go over this. So we are going to complete this because we're going to see all these other terms in other chapters. So I removed them, but somehow this computer is picking up the original chapters. So you have this one, so no worries about that. So let's talk about, it says right there, apply your knowledge. It says meaning and the term. The absence of blood. What is the absence of blood? Remember, this is anemia, no blood. Anemia. So the answer will be anemia. And no, without emia, no blood. A condition, no blood. But actually, it's not that you don't have blood. Remember, it's that you have low count of red blood cells or hemoglobin. Bluish color of the hands and the feet. Cyanosis. Cyan means blue. You need to learn the colors because these colors will be asked on national exam. What is cyano? Cyanosis is a condition of the bluish discoloration. See, cyanosis, bluish discoloration. Equal vision in both eyes. Now, this is amblyopia. This is not that common because we're going to see this in the census. So they just throw this in there. So, it's equal. Remember, isopia. We saw isoelectric. Opia means eyes. Iso means vision. Fast heart. See, we don't usually set fast heart. We set fast heart rate. So that will be tachycardia. Tachycardia. See, tachycardia. Breakdown of sugar. We know what is sugar, right? We can use glucose or we can use glycol. Well, in this case, because it's sugar, we're going to use glycol. And the breakdown of the destruction is lysis, glycolysis. See, glycolysis. You're going to be learning this as you go along. This is just for you to know some stuff. And I'm not going to ask you, test you, because you're just learning this. Later on, we're going to be repeating and repeating all these in the same in different chapters that you're going to get to know some of them. Right now, it will be unfair to ask all this. So it says right here, lack of white blood cells. So if it is lack of white blood cells, remember these are leukopenia. So it will be low blood cells, not lack. Lack means that you don't have them. That will be leukopenia, because penia means low, deficiency, leuko, white blood cells. Softening of the bones. Remember that softening means malacia of the bones, osteo. So osteomalacia. Osteomalacia. Inflammation of a vein. What is inflammation? Iris. What is vein? Phlevo. So phlebitis. Phlebitis. Nerve pain. So that will be, remember we talk about that, or you're gonna say nerve, it will be neuralgia, nerve pain, neuralgia. Signs of skin and its diseases. So that will be dermopathy or dermapathy, or what else skin we're gonna use. So let's see what they have right here. Oh, the science, I'm sorry. The science, not the disease. Dermatopathy. So this is dermatology. This is the study of, it's not the science, it's the science that studies, but it should be explained, the study of the skin. Logi is the study, and dermat is skin. So these questions are not stated correctly. Now, pay attention to this because this is very important. When you're reading a medical term, these medical terms, you start from the suffix. See, lack of white blood cells. But you don't set white blood cells lack of. We don't say it like that. We say lack of red blood cells, lack of white blood cells. But when you read it as a medical term, you interpret it differently. It's the opposite way. Lack of penia, white blood cells leuco. So you put it differently. This is like for me that I speak Spanish or Portuguese. I use first not the suffix. I use first the word root, and then I talk about the suffix. So that's basically what it is. Here it's talking about the suffix first and then the word root, because that's how you translate it, because this is not English. So just to be clear with you, when you interpret a medical term, you start from the suffix. Leukopenia. Now I'm going to be translating this. Penia, lack of white blood cells. You go in reverse. Is that understood? When you interpret, when you translate a medical term, you start from the suffix. First, you set the suffix. When you read it, it's leukopenia. But when you translate it to English, you said lack or deficiency of white blood cells. That's how it's done. So each one of them has the same meaning. Okay, so here is just a summary of what you need to understand. The word root is the base or foundation of the medical term or the word that we are trying to define. A prefix is attached to the beginning of a medical term. See, this is what I want you to understand, to learn for now. Know this definition, these basics. A suffix is the word part that is attached to the end of the medical term. A combining vowel is used to link one word to another, like the root to root or root to the suffix. And usually the most common is O, then the I, then the E. Remember that. A combining form is nothing else than the word root plus the combining vowel. That's it. Whatever is now is just a pre-test. Read the questions, answer them, and that's it. We're done for today. Now, from now on, the chapters are shorter, so we're gonna be finishing like around 9 or something like that, okay? So for today, because it was the beginning, and this chapter is a little longer, so we stay in a little later. But from now on, these classes should be finishing like around 9. All right? Okay, guys. So this chapter is over. There are some questions there that you go over. That's like the pre-test. And that's, oh no, there's no pretest. It is the building words, but no worry about this because this I'm gonna be explaining later on. It takes a little more time. I don't wanna run with this. All right. So have a good night. Thank you for participating in the class, and I will be seeing you tomorrow then. Good night, guys.
Good night, teacher. See you tomorrow.
Sure. Nice meeting some of you today, and I hope that we continue. So, get over with this course and make it better. Take care, guys. Good night. See you tomorrow. Good night.